Okay, so good morning, everyone. It is my pleasure to welcome you to the End-Stage Renal Disease National Coordinating Center Patient and Family Engagement Learning and Action Network. My name is Jerome Bailey. This is the first virtual summit of its kind for the ESRD NCC Mpfce-LAN. We are thrilled to partner with the Centers for Medicare and Medicaid Services, or CMS, to bring you this two-day event which will provide patients and care partners the opportunity to gain information and the skills to be active members in their healthcare. The patient voice is essential to the work of CMS and the ESRD NCC. We count on you, we depend on you to influence our work of providing quality care for people affected by kidney disease across this country. Next slide, Matt. To help us kick off today's event, we are honored to have Jean Moody Williams, Deputy Director of the Center for Clinical Standards and Quality at CMS. Ms. Moody Williams is a member of the leadership team responsible for one of CMS's centers that has more than 400 employees and a $3 billion annual budget. She is responsible for working with a great team to lead policy activities for quality improvement programs, the End-Stage Renal Disease Networks, survey and certification, quality measures and health assessments, clinical standards, and the public reporting programs for hospitals, physicians, and ambulatory settings. Ms. Moody Williams received her Bachelor's of Science in Nursing from Hampton University and a Master's of Public Policy and Management from the University of Maryland, College Park. Please welcome Ms. Moody Williams.
Thank you, and thank you so much for inviting me to address you this morning. And I guess I should say that I invited myself, as when I heard that this event was happening, I asked if I could please come, because to me, this group is one of the most important groups that we deal with and work with and partner with at CMS. So thank you for honoring my request to crash the party. But prior to the pandemic, we would likely be meeting and having this discussion in a conference room, maybe over dinner at our quality conference for those of you who I've known over the years. But of course, over this past year, coronavirus has presented major changes in the lives of people across the country. As a matter of fact, it was right after we came out of the quality conference last year, we got a call even before we left the hotel, alerting us to things happening in Washington State that really kind of changed the way we live, the way we, the way we work and the way we play. So you, I know, have had to face the challenge of taking care of yourself and possibly others to stay safe during a pandemic, plus the challenges of a chronic illness like with kidney disease. And some of you have had to change dialysis facilities from which you usually receive your service. You may have had to change your shift. You know, sometimes there were evening shifts if in fact you had COVID, or you had to find alternative transportation arrangements. And you may have even had to delay needed surgeries or procedures because we know that a lot of that was happening throughout the country. But I had the wonderful opportunity to work with patients and families in the ESRD community for many years. And I've always been so impressed with the individuals in the greater kidney community. You've always had such great compassion for your fellow kidney patients, your wisdom and your unstoppable willingness to support one another. As a matter of fact, we were in we have daily kind of staff meetings to see where we are with COVID and what's happening with nursing home and dialysis. And we know and extend our thoughts to those patients and families in Texas that are dealing with having to find places to get dialyzed, water's frozen or not available. But the one thing we talked about was how the facilities themselves come together and cooperate to make sure that patients get what they need, but that the patients and their families themselves come together to support one another. This was especially true when coronavirus forced our nation to take the unprecedented steps in 2020 that we had to, many flexibilities that we provided for coverage, for insurance payment, for being able to get treatment outside of traditional locations. CMS and the ESRD National Coordinating Center, along with the ESRD Network programs, we came to what we call in the field subject matter experts. So when we use that term, it's usually talking about maybe the people that develop the quality measures, or we have nephrologists on staff, or if it's for one of our other programs, some of our policy experts. But for what it matters to patients and families, you are the subject matter experts. Because you know what you need for your care. So your efforts to keep kidney patients and their families engaged and informing us and them of continuous changes occurring in healthcare is really what helped us in many ways get through some of the difficult decisions that had to be made during the course of a pandemic. And I do mean, for everybody, balancing, if you do this, what are the consequences? If you report this quality measure, or if you stop reporting this quality measure, does that mean there's going to be enough information available for patients and families afterwards to assess the quality of care? Or do you want them spending time reporting versus patient care? All of that had to come into play, even as we were looking at oversight for our survey agencies. It was mentioned at the top that we had 400 staff, and actually that was true until about the time of the quality conference. Right after that, we fully implemented our reorganization, and now we have about 800 people in our staff because we brought the survey and certification team and some of our quality staff into our center so that we could make sure that people that were doing the oversight in the facilities, making sure that they are ensuring safety, also the same people that were helping to write policy so that we can make sure there was no disconnect. But what you did was you helped to create and distribute useful COVID-19 tools and resources to members of the ESRD community. You shared the patient perspective, particularly on home dialysis or kidney transplants, which became increasingly important as we looked for alternative ways of delivering care for those that couldn't come into a center or actually may have preferred just to be home if they could. But we know the training that's involved with that and sometimes the family engagement, but you were able to help navigate some of that, and also collaborating with CMS on how to help patients cope with the impact of COVID-19, the mental and physical health.
Looks like we have a technical issue with Miss Jean Moody Williams, but she's back. We can see you now.
Okay, can you see me now?
Okay. Yeah, we can see and hear you.
Okay, I don't know what the last thing you heard me say. I talked about how the coping and mental and physical health. Did you hear me say that?
Yes, yes.
Okay, great. So, my point there was that sometimes people shy away from talking about their challenges, especially knowing so many people are struggling. But when you give that self-expression, it is important, and speaking up about your experiences, because that really helps others feel comfortable. Well, if they can talk about their experience, then maybe it's okay for me to talk about mine. And then that builds that support structure that really helps with some of the mental challenges that we all go through. And I know that you worked with the ESRD NCC and through their work, we developed a web page that's continually updated with information and created patient and family focused resources, such as the COVID-19 frequently asked questions. And I know that's also available in Spanish as well. We had partnerships with different organizations outside of the ESRD network, because too often we only want to work within our own little networks. However, we know that patients and families, when you have kidney disease, may have other things, and too often we isolate and we don't coordinate across all of the care needs. So those partnerships were created. I know there were 28 webinars specifically for patients and families, and social media. We have to be on social media. Over 38,000 unique people on social media, and things were tweeted and retweeted and Instagram and liked and loved and all of that. So it kind of helped us spread the word. So I did want to remind you that we do have a virtual quality conference this year. And I'm pleased to say that Patrick Gee and Antoinette Ingram will be on the main stage with me virtually, but they will be telling their stories and letting the healthcare professionals, and as you may know, there are a couple thousand that join, know what we can do to better care for people with kidney disease. And kidney health, I should say, kidney health is a priority for CMS. And we passed a regulation back in November related to organ procurement organizations, really to improve the quality of those organizations so that more organs can be available for transplantation. And we have a large group at CMS that's going to be working on that over the course of the year for transplant, getting people on the waiting list, off the waiting list, organs transplanted. That will continue to be a priority. So I want to just end. I don't want to take up all your time, and but I do want to say again, thank you for letting me join. We are, as a nation, experiencing something that we really couldn't anticipate, but working hard to get back to the new way that healthcare will be delivered. As a matter of fact, I will leave you after this as we begin to talk about vaccine distribution and how to make sure that the vaccines get where they need to be. And we'll also be talking with dialysis. We've talked with dialysis patients about that. But with all that, great strides have been made, and it's primarily due to your collaboration, your focus, understanding, you taking time to come to a meeting such as this. So we thank you for your continued participation. I want to take this time now to thank my staff. I don't often get to do that in public. They just, I just can't even tell you, they've just worked tirelessly around the clock and nothing but trying to get care to the patients. So thank you to CMS, but I also want to thank the National Coordinating Center, and I want to thank the ESRD Networks, but most importantly, you. Thank you.
Thank you, Ms. Jean Moody Williams. We appreciate you being on today to speak to the participants of today's summit. Thank you.
Hello, everyone. At this time, I'd like to again welcome you to the 2021 National Patient and Family Engagement Learning and Action Network. My name is Kim Bittner, and if we could have the next slide, please, Matt. We are excited to be with you for this first NPFE-LAN Summit, as Jerome had said earlier. The summit theme is Patients Partnering in a Pandemic. The theme and sessions you see over the next 2 days come from patients, and most of the speakers you will hear from are people living with or affected by kidney disease. Our goal for the summit is to offer an innovative format. The sessions are unique, and we hope it will further unite the kidney community. We believe this will be an enjoyable experience for everyone. Over the last year, we've had the pleasure of working with some extraordinary individuals that, despite their own challenges, were connected by a mission to educate fellow patients about protecting themselves from COVID-19, improving patient access to home dialysis and kidney transplantation, and teaching others about the importance of taking an active role in their care. Before we continue with the program, we would like to share more information about the End-Stage Renal Disease National Coordinating Center, the Mpfe-LAN, and the ESRD Network program. Jerome?
Thank you, Kim. Matt, next slide, please. So you are looking at your Mpfe-LAN team. My name, again, is Jerome Bailey, and Kim Bittner is my partner in crime. And we work with a great group of patients from the 18 ESRD networks that make up the Mpfe-LAN. Next slide. So just to give you a little information about what the ESRD is and what the ESRD NCC does. So we support and coordinate national activities of the ESRD network programs, including the 18 ESRD networks. All of the patients, all of the country is divided into 18 different networks, and these 18 different networks serve the dialysis and transplant patients across the country. We bring together the Npfc and the quality improvement activity LANs. We develop and offer resources and educational materials for both patients and providers. And then we try to engage patients and their care partners to become engaged, educated, and empowered. Next slide, please. So what is the Mpfe-LAN? The Mpfe-LAN is a group of patients, caregivers, healthcare professionals, and others interested in kidney care who work together to make healthcare better for kidney patients. LANs value the knowledge that the members bring to the group and use the information and ideas shared by the members to make improvements quickly through many small changes. These small, quick improvements can add up to make a big difference in the lives of kidney patients. Kim?
Thank you, Jerome. Next slide. So how do patients benefit from the Mpfe-LAN? The Mpfe-LAN is a give and take of knowledge sharing between the members of the LAN that allows them to share from others, and then it tailors their experiences to improve their own circumstances. So we learn from your experiences, and then you learn from each other as well. Next slide. Jerome?
Here's the vision of the Mpfe-LAN. We include the patient's voice in all areas of kidney care. It's designed to spread practical approaches to help other patients become engaged in their health and care to improve their quality of life. And then support the spread of the resources to the ESRD networks, dialysis facilities, transplant centers, renal community advocacy groups. So next slide, please. So at the foundation of the Mpfe-LAN is to create a community of sharing. Then we try to share the LAN's work beyond its members. And at the top of our goals is to improve the quality of care and life for all kidney patients.
Next slide. So the Mpfe-LAN objectives. Our foundation is to create a community of sharing, and we want to share from every patient voice, or we want to hear from every patient voice on the call. Our movement is to share the LAN beyond our members. So we have our members within our call, but then we want to share it outside of that call as well. And we do this from our quarterly Mpfe-LAN calls, and then our affinity group calls, which are monthly. We ask our networks, to share the approaches of the ESRD NCC and within their network websites. And then we encourage the patients as part of the Mpfe-LAN to share their work with their facilities and throughout the kidney community. We also invite the renal community to partner with us and to participate. For outcomes, our goal is to improve the quality and care of life for all kidney patients. This year, our goals were to increase the number of patients who chose home dialysis or were transplanted, received a kidney transplant, and to reduce the bloodstream infections, BSIs. We also have an affinity group in which the patients choose their own topic. That's a patient-selected topic affinity group. And the goal there was to achieve a positive change within that affinity group and their topic. Jerome?
So the NpfE-LAN also aligns with the ESRD networks. As I mentioned, there are 18 ESRD networks. All the networks work on quality improvement activities, and all the QIAs need ideas from patients and families, and that's where we get those ideas. You have the ideas that can help. Next slide. So if you would like to learn more about the ESRD NCC and see the work of the NpfE-LAN, they're on the ESRD NCC website. Just click on patients, or you can select the NpfE-LAN affinity groups, and the work of the NpfE-LAN SMEs are arranged by the affinity groups.
At this time, we'd just like to remind you that you can follow us on social media for any updates about events, resources that we are creating, things that our patient SMEs and family member SMEs are doing. You can like us on Facebook through like ESRD NCC, follow us on Twitter at ESRD NCC, and you can also find us on YouTube at search ESRD NCC. And at this time, I'd like to turn it over to Jerome for a nice surprise.
Thank you, Kim. So over the last year, we had the pleasure of working with some amazing people during a challenging time. Our partners at CMS and the ESRD networks asked our patient and family subject matter experts to share of themselves, to provide input on resources, to mentor others, and they always said yes. You are a wonderful group of individuals, and we wanted to show you how much you are appreciated, so we put together a short video to say thank you. Matt?
My hope for other people who are affected with kidney disease is that they will learn to find their own voices. Not only find their voices, but use it, because everyone has a choice and everyone needs to understand and express their choices as well.
hope for other people affected by kidney disease is that they truly become an advocate for their own health care, and that they help raise awareness for end-stage renal disease and help raise awareness for donors for kidneys.
We all deserve the best care that we can get, and it's important to educate yourself and be knowledgeable so that you can make the best choices for you.
Once again, thank you everyone for all of the work that you've done this past year. We really do appreciate it. So we are going to stand by now for about 2 minutes so that we can get our next session up and ready. We'll begin in about 2 minutes or so.